Welcome to The Explainer. Today we're diving into something really fascinating, a manifesto called The Reflective Mind. It's all about bringing a more human touch back to medicine, focusing on depth and meaning. It really challenges us to ask, what does it actually mean to heal? So the whole idea really boils down to this one powerful statement. Think about it. It's saying that treating someone isn't just, like a mechanic fixing a car. It's about getting into what an illness means in the context of a person's life. And right away, that one thought, it just completely changes the game. We're not just talking about science anymore, we're talking about science and humanity together. Okay, so why now? Why is this kind of thinking so important today? Well, the manifesto points to what it calls the space of tension. And this is really about a huge conflict, a paradox that's right at the center of modern medicine. And I bet this is something a lot of you have felt. We're just bombarded with news about amazing medical breakthroughs, right? But then when you or someone you love gets sick, there's this weird disconnect. It's like the treatment for the disease is over here, and the care for the actual person who's suffering is somewhere else entirely. So here's that paradox laid out perfectly. On one hand, you've got this incredible medical progress. We can measure, literally almost everything. We can treat diseases with amazing efficiency. But on the other hand, there's this growing sense of human confusion. We don't always understand what our illness even means. We struggle to deal with suffering in a wise way. So the big question is, does all that data actually lead to real understanding? It's a tough one. All right, so if that's the problem, what's the solution? Well, this philosophy suggests we need a new path forward, and it all starts by totally reframing how we even think about illness in the first place. So, from this perspective, healing is not a quick fix. It's not just taking a pill or having a procedure and poof, you're done. No, it's way deeper than that. It's more like a process of weaving everything back together. Your body, your mind, your personal story, what the manifesto calls your narrative, and trying to find that feeling of wholeness again. And this is the absolute key, right here. It's a huge shift in how we see things. The typical way, the standard medical model, kind of treats illness like a bug in the software, an error that just needs to be deleted. But this approach, it says, wait a minute, what if illness isn't an error but a signal? A disruption that's trying to tell us something. It's something that needs to be listened to be understood, not just silenced. So what are the guiding principles here? Well, it's really all about finding a balance. It's not throwing out science, no way. It values clinical rigor, but it refuses to reduce a person to just a set of data points. It absolutely respects evidence, but it also listens to people's stories. It's this beautiful intersection of medicine, philosophy, and just real lived experience. And it's all done clearly, without a big spectacle, and slowly, without all the usual rush and urgency. Okay, now this is just as important. We need to be super clear about what this philosophy is not. The manifesto really wants to set expectations and cut through all the noise you hear from the, modern wellness industry. So you might be thinking, if it's not offering me easy answers, then what's the point? What is it offering? First off, you're not going to find any easy solutions here. Period. This approach gets that health is complicated, and it just doesn't do simplistic fixes. And you won't find any shortcuts to wellness either. It rejects that whole idea. Real wellness is a journey, right? It's not some destination you can just magically arrive at overnight. And last but not least, no cheesy motivational slogans. This whole philosophy is about depth, about real understanding, not just a bunch of surface-level hype. So if that's what you won't find, what will you find? Well, what you'll find is more like an invitation to go deeper. It offers careful reflection, space for thoughtful questioning, and a real, genuine attempt to bring some depth back to how we talk about health. It's all about chasing true understanding, not just piling up more and more information. So who is this for exactly? The manifesto is pretty clear that it's extending an invitation to a certain kind of person. This is for the clinicians out there who feel boxed in by protocols, who really want to connect with their patients on a deeper level. It's also for patients, maybe you've been there, who want more than just a mechanical explanation. You want meaning. And really, it's for anyone who believes that medicine isn't just a science, but a human art. And this right here is such an important distinction to make. The goal isn't to try and persuade you that this is the one true way. Nope. It's about trying to bring some clarity to the whole messy, complex world of health.
It's not promising certainty, because let's be honest, that's usually an illusion anyway. Instead, it's about helping us develop discernment, that wisdom to be able to navigate tough situations with real care and thought.
So when you boil it all down, what's the takeaway? It's really a simple but pretty profound call to action. Step 1, just slow down. In a world that's always screaming at us to go faster. Step 2, think carefully. We're flooded with information, so we need to be thoughtful. And step 3, engage with medicine as what it is, a deeply human encounter, not just another service to be consumed. And that really leaves us with this final, powerful idea to chew on. Maybe, just maybe, the most valuable thing we can look for when it comes to our health isn't a perfect set of answers. Maybe it's a deeper, more meaningful understanding. Just think, what might change for you, for all of us, if we started approaching healing not just as a problem to be fixed, but as something that might have something to teach us?